Annual exams are very important because they are designed to pick up on abnormalities and to stay ahead of preventative screenings. We get labs every year when we go for our annual exams. And things that we can see is if our cholesterol is now abnormal. We can see what our hemoglobin A1C is, what is our fasting glucose. All of those labs are indicators of a health problem whenever there's an abnormality. The other thing that annual exams do is they stay on top of screening. What they're not necessarily so great at is picking up early signs of future disease. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what works, and what's backed by evidence. I'm your host, Dr. AK. Let's get started. Hey everybody, welcome back. Today we are going to talk about something that should basically be a part of Adulting 101, and that is getting your annual exam by your primary care provider, that yearly physical, if you will. We go to the doctor, we get evaluated every year, we have our blood pressure, heart rate, and other vital signs measured. We have a physical exam done. Our physicians ask us a series of preventative health questions based on what screening exams we've received and are we smoking or doing any of these other things? And then we typically get lab work done. And then in a week or two, we usually get a phone call, hey, X, Y, and Z is normal, you look great, we'll see you next year. Or sometimes we get a call that says, oh, X, Y, and Z was abnormal, let's have you come in again, we need to talk about treatment options. And that is great. I am not knocking the annual exam, but the annual exam has a little bit of a blind spot. It is really good at detecting signs of disease once they are present. The annual exam is missing on other things that might be predictors of chronic disease in development. And that's what I want to talk about. What is it that the annual exam is not doing that we really should reconsider? And it should be a part of the yearly exam because it's a much better predictor of whether we're going to develop chronic disease or not, rather than identifying and waiting until we've already developed the disease. Now, I want to be very clear about something here. I am not knocking the annual exam. I think it's very important. I think it is absolutely important that we all get our proper screening exams, whether it's mammogram and pap smear for a woman, a PSA for men, colonoscopies for everybody once they're 45 years of age or older. I think staying up to date on vaccine schedules is important, like tetanus and whether you're getting your yearly flu or not. Somebody should own that, and I am very happy that our primary care providers are the ones who are stepping in and doing that. So I do think it's necessary. I do also think it's necessary to get lab values every year and see if anything is trending in an abnormal way. So let's just be very clear that I think annual exams are valuable. I just think they're missing things, and it's the things that they're missing that we're going to talk about. We're not knocking annual exams. One of the most important things that we have recognized in medicine is that chronic disease develops over years of exposure to something. That's not something that we stayed on top of before, but more and more in today's research and information that we're finding out, we know that it's years of exposure. It's not like you went to bed last night and you were 100% healthy and everything was great, and then all of a sudden today you wake up diabetic. That's not how things happen. And we're learning more about those mechanisms and how to track and trend those things. For example, when it comes to strokes and heart attack, most people have had years of atherosclerotic accumulation of plaque. Most people, and I'm not going to say all, there are some people who are actually really healthy and have a thrombus and these things happen. But for most people, that is not how it happens. You've had years of plaque buildup. For metabolic syndrome, once you become type 2 diabetic, there were signs and symptoms of insulin resistance way before you became diabetic. And then there are other things that we know about with our health. We know that muscle mass is really important. Frailty, stability, muscle strength. The better you are as you age with these, the better your lifespan is. Another thing that we often don't track is cognition. It's not until a family member is like, my dad or my partner or my mom, they seem to be really forgetful. They're putting things in places that they forget more often. They're forgetting words. They're forgetting people. And then all of a sudden we're like, oh, we should probably do some cognitive testing. But had we done the right tests early on, we may have had a heads up that that was going to happen. And we may have been able to intervene and make some changes early on to prevent it from getting worse. Let's talk about what a modern annual physical exam should include. Now that we have all of this additional information about chronic disease, what should that annual physical look like? When it comes to cardiovascular health, we are missing some really important physical markers. Yes, lipids are important. Yes, blood pressure is important. And these are things that should be checked. But not all of our lipids are generally checked. Just recently, and bravo and kudos to the AHA and ACC, did screening for an apolipoprotein a become a recommendation. So now the recommendation is that everybody have an LP measured once in their lifetime to help give an idea about future cardiovascular risk. So that's new and that's good, and I hope that becomes a part of regular screening. But there are still other things of cardiovascular health that we're missing. First of all, we are not trending or tracking heart rate variability. Heart rate variability is that tiny, tiny little measurement of the changes between each heartbeat. So every heartbeat isn't a symmetric lub-dub, lub-dub. There's a little bit of variation between them. And we want there to be a little bit of variation because that gives us an idea of the balance between our autonomic nervous system, our sympathetic, which is our yeah, go, hype, I'm ready to fight, I'm ready to, and the parasympathetic, which is the, dude, calm down, digest your food, take a nap, relax. There is a balance between those. And when you have a high HRV, that gives us a good idea of how good that balance is. So the higher the HRV, the better, up to a certain extent, because some arrhythmias can have a high HRV, which is not good. So if you don't have an arrhythmia and you have a high HRV, that indicates you have a good balance between your autonomic nervous system. And we know that a higher HRV shows a lower all-cause mortality. Nobody's measuring HRV. Another thing that nobody's measuring is VO2 max, and I've talked about this before. Your body produces ATP, which is adenosine triphosphate. You need that for energy production, for everything. I mean, for everything. If you don't make ATP, you die. That's how people die of cyanide poisoning. So you have to have ATP in order to live. And our body has two different pathways of making ATP. One is with oxygen, and one is without the presence of oxygen. The oxygen pathway produces anywhere from 32 to 36 molecules of ATP. The non-oxygen one, it's like 2 to 6. So obviously, if we can produce more ATP with the use of oxygen, that's better. And that's what VO2 max measures. It measures that threshold of where your body goes from transitioning from using oxygen to make ATP to not being able to use oxygen. And the higher our VO2 max, the better our longevity. We have a lower all-cause mortality. And the other thing about VO2 max is it's modifiable. So if you go and you get a physical and your VO2 max is low, you can actually do something about it to make it better and improve your cardiovascular health. But nobody's measuring that. Correction, I measure that, but it's not a part of the routine annual physical exam, which is what my argument is here. It should be a part of it. Another thing we don't measure is zone 2 output. So when we exercise, we have a certain heart rate that we're at where we could exercise forever. It's super boring, but it's a really good marker of endurance. And our rate of perceived exertion is usually at a 2, which means if you were exercising with a friend, you could talk to them, but if for whatever reason you wanted to bust out and sing a song, you wouldn't be able to. You'd be too out of breath. That is our zone 2. And the higher our energy that we're able to put out when we're in zone 2, the better our mitochondrial work. the more efficient our heart beats. Another thing that doesn't get measured, but it really should, because that, along with the VO2 max and along with HRV, are all things that give us a much better picture of our cardiovascular health. When it comes to metabolic health, we're getting the hemoglobin A1C, which is great. We're getting a fasting glucose, which is great. But not a lot of us are getting a fasting insulin. And the reason that's important is there's a score, it's called the HOMA-IR score. It's basically a ratio between your fasting glucose and your fasting insulin, and it is a very early marker for developing insulin resistance. So if we see that the HOMA-IR score is starting to creep up, we are going to have a heads up that, hey, metabolic syndrome is on its way before we see changes in the hemoglobin A1C and the fasting glucose alone. And this is another thing that is reversible. There are things that we can do. There are lifestyle modifications that we can make that can actually change that so that in the future, when we go for another exam, we can get another HOMA-IR score and measure the progress of our efforts over the course of the last year. Now, depending on how old you are, you may or may not have a cognitive evaluation at the annual exam. It is typically something that is done once patients reach 65 years of age or older. It's something called a mini mental status exam, and that's fine. But there are other tests that are out there that I think would be much more beneficial and can be done on younger patients. The main one is the Montreal Cognitive Assessment. It's abbreviated as MoCA. And this is a test that you can do every year, and then you can trend the results and you can start to detect really subtle changes in cognition. And it's also a great test to tell you in what part of cognition those subtle changes occur. Another thing is ApoE phenotype testing. So ApoE is a lipoprotein. We've talked about lipoproteins before, but the significance of ApoE is that we know there are 3 different types, and you can have a different combination of those types. The types are 2, 3, and 4. So ApoE2, ApoE3, ApoE4. And you can have a combo of like 2-3, 3-3, 3-4, 2-4, or just 2-2, 3-3, 4-4. You can have any of those combinations. We know that people with ApoE2-2 have some genetic protection against developing dementia. We also know that people who are ApoE4-4 have a higher risk of developing dementia. And the 3s, you're just kind of hanging out, you're there. If you're a 3-2, that's a little bonus because you have some protection. And if you're a 3-4, that's a little bit of a minus because you have a little bit more of a risk. So could you imagine going to your family doctor, getting your ApoE phenotype, and knowing what your phenotype is ahead of time so you have a heads up on what your genetic risks are? Add to that a MoCA screening exam that you do every year, and now you start to detect whether there are subtle changes that start. You have the genotypic information so that you can make the lifestyle modifications. For example, my ApoE4 patients, we talk about the MINDS diet. We talk about the avoidance of alcohol and other substances. We talk about the importance of cardiovascular exercise. These are evidence-based strategies in delaying the onset of dementia. But if you don't know what your ApoE phenotype is, you don't know what your risk factors are going into it. That's huge. On top of that, you can do MoCA testing, which can tell you way earlier on of whether maybe some of those preventative meds that are out there might be helpful or not. So we have all kinds of medications that are out for Alzheimer's dementia. Some of them show some benefit, some of them we're not so sure, but we do know that what they tend to do is slow progression. So if we are doing MoCA cognitive evaluations and we see there's even a sniff of change, we can now consider starting some of those medications early on rather than waiting until people have a more advanced cognitive decline. Huge, and we're not doing it. I would love to know how many of you, when you go get an annual physical exam, are getting a body composition done. I have one of those in my office. I paid a ton of money for it, and it's worth every penny because I can measure people's muscle mass. I can measure their body fat. I can measure where they need to do a little bit more work. For example, if I have a patient who comes in and the bulk share of their muscle mass is in their upper body, I can tell them, like, listen, man, you got to do some more heavy lifting in your legs because once you get older, if balance becomes an issue, you're top heavy and you're going to fall over. You're at higher risk of fall. For my patients who have more muscle mass in their lower body and not really their upper body, I'm like, listen, you might not be able to carry your groceries when you get older. Body composition is so important because it allows us to keep an eye on muscle mass, which we know is directly related to sarcopenia. That is when you lose muscle mass and you start to become frail. The other part that we often don't do in the office are functional tests, balance tests, stability tests. When you start to do these early on, it gives us a heads up of, hey, you might want to consider some Pilates. Hey, you need to do some more stability exercises. Oh, you know what? Yoga would be really good for you because your flexibility is really starting to suffer. And we know muscle mass, strength, flexibility, balance, these are all huge as we get older. Grip strength, that is a marker for generalized strength. I highly doubt people are getting a grip strength assessment as part of their annual exam every year. And these are all the things that I do in my office because they're evidence-based. None of these things that I'm talking about right now are experimental. None of this is pseudoscience. None of this is biohacking. These are data points that have been published in JAMA, in The Lancet, in the New England Journal of Medicine, in really, really reliable and dependable journals. We know that they are markers that can predict our lifespan and the development of chronic disease down the road, and they're modifiable. That's the thing that is so huge. We can get these measurements, see what they are, and then we can actually do stuff to change it, which I think is just huge. If you are in your 30s, if you are in your 40s, we don't think about what happens whenever we are 70 or 80. But the fact of the matter is we should be, because the things we do now greatly influence how we are going to age. And we should be getting these measurements and these tests. I will fully admit, I get all of these in my office. I think they are integral data points that are required to put personalized plans together for all of my patients. But it shouldn't just be my patients. Everybody should be doing this. If you are getting a yearly physical exam, these are things that should be done. There's all kinds of stuff out there about different testing that needs to be done, right? We can get into the controversies of cancer screenings, right? Whether you go get these whole body MRIs and CAT scans, that's a discussion for another day. I've already talked about how I think these gut microbiome tests that people are doing are complete nonsense. We have no idea what bacteria does what in each individual body, and we happen to know that most probiotics don't even make it to the gut anyways, and the ones that do die off as soon as you're done taking the probiotic. There's a lot that we know about gut microbiome is nonsense, yet these tests are being done. VO2 max is not. That's just crazy to me. It's crazy to me that we're not doing these tests as a part of our annual physical exam. And going back to what I said before, I am not knocking the annual exam. I think it is really important. Having your regular cancer screenings is important. Having people who keep track of that is important. And getting the labs that we do get to find abnormalities is important. My only argument is that there is a lot of data that is missing from those annual exams, and I really think that we should be more proactive in achieving this information for our own long-term health. This is a huge opportunity to shift the focus of identifying disease when it exists versus looking for the risk factors and the markers that are predictors of development of disease, and then having the opportunity to make the changes to prevent those diseases from developing. If you want more information on this topic, I did write a blog post on it, and I have all the different references for everything that I said in the blog post. I suggest you go there and read it to get more details on all of the information. And then I would go have a conversation with my doctor. I would talk to them about these different kinds of tests. You would be surprised. A lot of your doctors are very open to ordering some of these additional lab tests. Not all of them have the capabilities to do VO2 max testing. And so you might have to look for other sources and other places to go get that testing. Not all of them are going to do body composition scans on you, but those are really important for you to keep track of to see what your muscle mass is doing. So start the conversation with your doctor, see what can be done in your doctor's office, and then look around and see what your other options are for some of this other testing. And that, my friends, is the end of today's podcast. So thank you for joining me this week. I really hope this provided you some important information on what you need to know in order to make sure that you have a nice, wonderful, long, and healthy life. I'll see you next week. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter, where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor. This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, The Whole Human Health and Wellbeing. Take care, and I'll talk to you next week.